how are you today?
Good, how are you?
Good. So today we're just going to do an eyes, ears, nose, and throat exam to assess for any abnormalities. So before we get started, I'm going to turn on hand sanitizer and close the curtain for privacy.
Thank you.
And will you tell me your name and date of birth?
Emily Bolser, 11/18/1999.
Okay, and can I see your wristband? Cool, so it matches. And I'm going to put on gloves before we get started. Okay, so we're just going to start by looking at your eyes, and the skin is pink, it's even with the rest of the skin tone, it's not dry, and there's no discharge, and there's no swelling. So I'm going to pull your lower lids down really quick to look at your eyes. Okay, so the conjunctiva are pink and the sclera is white bilaterally. And next, I'm just going to have you follow my hand with just your eyes and not your head, okay? Okay, so extraocular movements had no abnormalities, there was no twitching, no tics, so that's good. And now I'm going to reach around behind you and let me know when you see my fingers in your vision, okay?
Yeah.
Okay.
Yeah.
All right, good. So next we're gonna look at your pupils and I'm going to measure them. Okay, so they're equal and, sorry, they look like they're about 4 millimeters. Okay, so I'm gonna have you stare at the bridge of my nose or just at my finger, and I'm gonna shine this into your eyes. Okay, now I'm gonna do it once more and look at the other eye. Okay, good. So pupils were equal, round, and reactive to light, and they were accommodating. So now we're going to look at your ears. So the skin is again pink. It's consistent with the rest of the skin tone. There's no discharge and there's no lesions on them. So I'm gonna press down on your tragus and on your upper ear and let me know if there's any tenderness. All right, good. So now I'm gonna stand behind you and I'm gonna whisper a couple of things and I want you to repeat back what you hear to me. So I'm gonna be on your right side, so close your left ear.
This one.
Yeah, so
836.
yes.
9F2.
Yes, okay, good. So now we're gonna move on to the nose. So the skin again is consistent with the rest of the skin tone. It's pink, there's no lesions or discharge. And I'm gonna use this light to look up your nose. Okay. So the mucosa is pink and there's no discharge and the septum is midline. And now I'm gonna press down on your sinuses and again let me know if there's any tenderness. So your maxillary ones, and your frontal. Okay, good. Okay. So now we're just going to move on to your mouth, the last part. So your lips are pink and they're not dry or cracked or anything like that. Will you smile really big for me? Okay, so all teeth are present, the teeth are white. And would you open up your mouth? Okay, so oral mucosa is pink, the tongue is pink and it's midline and there's no lesions. And would you open up again and say ah? Okay, so the uvula rose with saying ah, so that is about it. And I'm just gonna put on hand sanitizer. And do you have any questions?
No.
Okay, well have a nice day.
Thank you.